Hello friends, I'm Dr. Swati Kanakia, Pediatric Hematologist Oncologist from Mumbai. In today's talk, I will be discussing maintenance chemotherapy, which is a very vital part of treating children with acute lymphoblastic leukemia. We all know that acute lymphoblastic leukemia has been a success story of modern medicine. We are able to cure more than 75% of children with this disease. There are different phases of treating ALL. The first one is the induction chemotherapy, followed by consolidation. Then we have a reinduction phase, and this is followed by the maintenance phase, which is what we are going to talk about today. The aim of maintenance chemotherapy is to target any residual cells, leukemia cells, which are present in the body, which may not be identified by either laboratory tests or clinically. We also want to get the level of these cancer cells very low so that the body's own immune system is then able to fight them off. How long is maintenance given? So typically it is several months, maybe a year or even more. It depends upon the protocol that your institute is following. So it is very important to listen to the doctor's advice and to continue treating the child even if the child's reports as well as the child appears normal. The idea is to give a very low dose chemotherapy which is very effective and yet it doesn't cause side effects. Which medicines are generally administered to the child in the maintenance phase? So 6-MP is given orally. You all know this drug, you have used it before. It is given daily at night, at least 45 minutes before dinner. Then there is weekly tablet methotrexate. There is intrathecal methotrexate and IV vincristine as well as prednisolone. And these are administered depending on the protocol that you're using. In this video, we will see more about maintenance chemotherapy and the practical aspects and what care should be taken. Friends, this is an educational initiative. We wish to empower patients and the parents so that the treatment of children with cancers as well as blood disorders is better, and we hope that this leads to better patient outcomes. Uh, Also remember friends that at no point in time does this video replace the consultation with your doctor. Please follow your doctor's advice and consult them at all times. Thank you.